I would say the urinary flow problems really started to become significantly challenging in my late 20s, mid to late 20s. I had had a procedure when I was very, very young, 8, 9 years old, that at the time didn't really know what it was about, but it was to open the urethral opening. And at that point, it was considered major surgery. But by my late 20s, just standing trying to urinate for 15 minutes just was getting really tiring and boring, and I started to consult urologists who pursued the standard course of treatment, which was an in-office procedure that one could liken to the Marquis de Sade. Basically, I've had a couple of urologists jokingly refer to it as, human roto-rootering. I think over the subsequent 8 or 9 years, 10 years, I probably had more than 7 or 8 of those. Typically, there was no specific time frame, but typically I'd go, 9 months, 12 months, go back to see whoever my consulting urologist at the time was, and they said, oh, let's do another one. And it would be done in office, and there's really no sedation other than local. It's very, very painful. And then I think I was probably in my mid to late 30s, and I was seeing a urologist at Cedars-Sinai Medical Center, and it was the first time he had talked about, let's do a laser urethrotomy. Sort of a more extreme, more sophisticated version of the in-office dilations that I had been doing over the years. And it was described as being a procedure that would more cleanly open the stricture, perhaps more permanently open the stricture, assuming that they didn't create too much scar tissue in the process of sort of burning through the narrowed portion of the urethra. And I did one of those. And I think it lasted for a bit. Don't remember exactly how long, but it lasted for a bit, longer than the in-office dilations did, but eventually ended up closing again. And I think I did 2 more of those over the subsequent years, never ultimately finding sort of permanent relief for the stricture. And as I got a bit older, thought there has to be a permanent solution to this. I mean, I can't imagine that this sort of regular ongoing intervention will have to take place. And virtually none of the urologists I had been seeing really spoke to any long-term solutions. Well, I think my biggest frustrations throughout the course of this entire experience has been not being able to find a urologist along the way, and I probably saw 4 or 5 over the course of my life until reaching Dr. Gelman. That none of them spoke to more aggressive, longer-term therapy. It was, the first immediate knee-jerk was, let's do an in-office dilation, which again, very painful, very traumatic to the urethra. Ultimately, in retrospect, learned that it probably created more trauma to the stricture region than not, and only provided limited temporary relief. And so I think my general frustration was, again, in retrospect, how come there wasn't more general understanding and knowledge about even the small community of surgeons that practiced this particular procedure? So as those frustrations grew to the point of wanting to go further than the advice and recommendations I was getting from the current urologist or urologist I was seeing, I started to turn to the internet to sort of see what the world was saying about urethral strictures. and ultimately came to understand that there was a procedure, extreme as it sounded, where the strictured portion of the urethra was spliced, for all intents and purposes, and replaced with some alternative tissue sourced from one of several different places on the patient's body. And again, as extreme as it sounded, from what I was learning and reading, it also sounded like it had a really good success rate, depending upon the skill of the surgeon and their level of experience doing the procedure. And it was clear there weren't a lot of surgeons really skilled at doing it. And at one point in discussing this with my local Southern California urologist, he said, you know, there's someone that I have heard does this procedure. I've heard good things about him. I don't know him personally. I think he's down at UC Irvine. Let me find the name for you. And some days thereafter, he called and he said, the name is Dr. Joel Gelman. He's at UC Irvine. This is the name of his clinic or his practice. You should contact him. And that started my relationship with Dr. Gelman, whom I obviously eventually ended up deciding would be the surgeon to perform the procedure. Not without significant challenges, because Dr. Gelman was not in my insurance network. So a good deal of the early part of our relationship, which is not uncommon in this particular field, because there are such a limited number of specialists who practice the procedure and practice it well, I would venture to guess that not an insignificant percentage of Dr. Gelman's patients, and perhaps other surgeons in this niche as well, find themselves wanting to seek treatment from that provider, but having some significant challenges related to their insurance doing so. And we spent, I don't know, 3-4 months, maybe longer, working through the administrative morass that is insurance. And eventually were successful at getting them to authorize the procedure as an in-network procedure. And we basically had to make a case that there wasn't an in-network surgeon, urological surgeon, who could perform the procedure effectively. And that while they could effectively force me to see a lesser qualified surgeon, the chances are their costs would actually end up being higher, because the surgery would have to be repeated perhaps multiple times by more competent surgeons. Well, it might be different now. I've heard from Dr. Gelman that whole landscape has shifted a lot, that there are more physicians saying, more urologists saying they do this procedure. You can talk to a practitioner who says they do something, but there's a big difference between doing it and doing it really well. Insurance networks don't have a very granular ability when they profile a physician and the physician checks off all the things that they're qualified to do. The insurance companies really don't have any great way to define that in a very granular way. I think the challenge that patients may face today is that they may speak to a urologist who says, oh yes, I do urethral stricture surgery and I can repair that urethral stricture. That if you haven't done it and done it a lot, I think the chances are your outcome won't be great. In terms of insurance, then your challenge is exacerbated beyond where it was for me, because I wasn't facing an issue where they said, oh, here's an in-network urological surgeon that can do this, and they're in network, you need to use them. There was nobody. I mean, part of the case that we made was we gave them a list of 20 urological surgeons that we'd consulted, all of whom said, we don't do that. That may be difficult today if you get some urological surgeon who says, I do, but they really shouldn't be doing it, or you really wouldn't want them doing it for you. I found Dr. Gelman from the very first consultation up to and including the periodic update phone calls we have up until today, to be an individual who truly cares about patients who struggle with urethral strictures. I mean, this is calling. I mean, he didn't, I think, pick this as much as it picked him. I think when he realized that there were individuals that struggled with urethral strictures and that there were more effective approaches that could be refined over time, I think it became a calling and a passion. And it, again, it speaks volumes every time you're with Dr. Gelman and or his staff. It's just what they do. And it instills a great sense of confidence in you as a patient. It's not that they're not capable of doing other things, but this is the core focus of their practice. So you get that immediately. It's an immediate difference when you go to any specialist who has created a subspecialty within their practice. And we've had that experience elsewhere in our family as well, where we went to someone who is a XYZ surgeon, but a very significant portion of their practices centers around one problem and one procedure. And it's very clear that that practice, from top to bottom, from the first phone call you make to the first consultation through your entire relationship with that practitioner, is really geared completely towards that issue, the language surrounding that issue, the treatment surrounding that, all of that. And that became immediately clear with Dr. Gelman. This is a physician that knows strictures, that has eaten, breathed, slept strictures for the better part of his medical career. So that strikes you immediately, that this is not just something that he does. It isn't just a percentage of his practice. This really is the meat and potatoes of his practice. And that gives you a great sense of comfort that I'm not going to be the first stricture this person has seen. I may be the 500th or 1,000th stricture that this person has seen. They've seen every shape, size, length, diameter, consistency of stricture out there. And that experience is going to let them frame up my particular stricture effectively and accurately, so that I'll have a better sense about the treatment approach, surgical approach, all of that. After the catheter is out, obviously you get your first opportunity to urinate post-surgically, which the first time is a bit scary because you're deathly afraid you're going to explode, burst sutures and seams, and things will be just a horrible mess. So there's a pretty significant bit of tentativeness surrounding that. But once you sort of let go and let nature take its course, the flow was extraordinary. It was like Old Faithful by comparison to pre-surgery. It wasn't a completely unique experience because over the years I had had plenty of procedures that opened up the stricture almost completely, but never for very long. So it wasn't the first time I had in my adult life where I had urinated without impediment, but it was the first time I had done it where it lasted and continues to last today. It hasn't, for the first 5 years or so after the procedure, 6 years after the procedure, I did annual flow tests with a local urologist just to see whether or not there were any changes in flow rate. And I stopped doing them 2 years ago because it didn't feel necessary. There was never any change, and I've, to this day, don't think it's felt any different than it did the first time after the catheter came out. One of the greatest benefits of the procedure is that the journey's over. I mean, you realize within a year or so that this isn't going to be like all of the other procedures that you've had over the years, that this worked, that this isn't going to close up again. And at that point, the search, the journey, the trials and tribulations related to urethral stricture are done. They're gone. I mean, I kept waiting for the other shoe to drop because that's what had always happened. And no procedure is always 100% guaranteed. You could be the one in a million whose body just decides, I'm not putting up with this. I'm going to stricture someplace else along the urethra now. And it never did. And at this point, I'm pretty confident it never will. I mean, I'd be floored if I started experiencing stricture-related symptoms and restricted flow. At this point, it doesn't even really cross my mind. Every once in a while when I urinate, I'll have an aha moment. Like, God, I can't even remember back to when that used to take 10 minutes.